Okay, and last but certainly not least, I welcome our friend and accomplished manager of Sunshine Coast Mental Health and Substance Use Services, Susann Richter, to the podium. Susann was with us on our first Med Talk, and she's actually been advising on every Med Talk since. So in partnership with Susann and her team, the Hospital Foundation, and our donors, work to improve the status of our mental health services and facilities on the Sunshine Coast. So please join me in a warm welcome for Susann.
Okay, thanks, Jane. I'd really just like to start out by thanking Jane and the foundation and the board and everyone who's really been working so hard to put together these Med Talks, because I think that this kind of community dialogue is so important to our understanding of each other, the health service providers and the community. And this particular topic is rich, as you can see from the different speakers that we've had tonight, with all kinds of social and health issues. And I think this form of dialogue is really the way that we learn from each other. What are the issues? What questions do people have? What's out there? Who's providing what services in the community? And also what health services do we have available? And that's mostly what I'm going to address tonight. I'm going to try and keep it short because I know we need to end at about 9 o'clock. And we want to leave adequate time for your questions and for some discussion. And much of what I was planning to say has actually been addressed, in particular some of the issues that Dr. Borali was talking about in terms of where are we at in terms of research around cannabis. I did want to add to that that the decriminalization of this topic has, I think, opened the coffers of government to research, and I think that's one of the big benefits of decriminalization. The other one, though, that hasn't been mentioned yet tonight that I really wanted to talk about was that when you decriminalize this type of issue, it reduces the stigma, and it makes it much more possible for people to come to health services, to be open in talking about what is going on with them in terms of their substance use. And so the criminalization, I think, has been a big barrier to people for a long time. I was just recently at a meeting about the response to the fatal overdose emergency that's happening in this province. And so the province has been connecting with communities to find out what they believe are the biggest issues and the biggest causes of fatal overdoses around the opiate crisis. And they have identified stigma and prohibition as being the biggest risk factors in terms of what communities are coping with. And so I think that that's a really good illustration of how prohibition and criminalization of substances can cause huge social and personal disadvantages. So in that sense, you know, the fact that we're able to be here at sort of ground zero in this discussion, I think is very exciting, and hopefully we'll hear your questions soon. So I did also want to mention that the Government of Canada, in August of this year, has been acknowledging that there's a great gap in our research. And they have started to fund particular questions. And some of them include, are young people more at risk as a result of legalization? How does cannabis use affect different communities and populations? What are the effects of marijuana use on driving? And what are the health benefits of marijuana, both THC and CBD? So I think, you know, from 5 to 10 years from now, we're going to have a lot more information, and that information will be used by the medical community. And I think that our physicians will have more confidence in working with cannabis as a type of medicine that could be very useful. But we really do need to improve the level of research that we have access to. So as Dr. Borali said, medicine is really just one aspect of how we need to work with substance use and addiction issues. And so what I wanted to talk about a little bit today was what are the services that we have available in our community that help people to cope with these types of issues. We do actually have quite a great continuum of services in our community, and we have some gaps as well, which I will talk about. As an overview, we have 6 inpatient psychiatric beds in the hospital, and I think we've only had those since 2006, so it's relatively recent that we've had that added. We have a community mental health and substance use team, and a couple of members of that team are here. Tim Hayward is our team leader, and Shannon Stars is our mental health emergency services nurse, and I don't know if I've missed anybody else, but, and I'll talk a little bit more about what that team provides. We also have a 28-bed residential rehab recovery unit, which is called Sumac Place, that some of you may be aware of. That's actually a regional program, and it serves people who have very complex mental health issues. And it's a place where people can improve their quality of life and hopefully move on to greater independence. And we also have a variety of supported housing in the community, so I'll talk a little bit about that. But our community team provides services from Monday to Friday from 8:30 to 4:30, and we're located on the hospital campus. You may have seen our green trailers, which are, I guess, at the south end, and that's one of the things that the foundation is going to be assisting us with in the future. We're hoping to do a rebuild of our facilities, and that will include a new inpatient unit and a new home for our community mental health team that has been living in trailers for a while. We have 4 psychiatrists. You met Dr. Burali this evening, who work with all of our teams and in the hospital. So we're very fortunate to have psychiatric services that work with every other aspect of the mental health services that we provide. We have an older adult program, and that's for older adults who are having a decline in their cognition, or they may have a mood disorder or another psychiatric illness, and that includes substance use as well. And that team has nurses and a social worker. Our counseling team that Tim has been part of for many years work with people in sort of a short-term therapy. I think it's up to 12 sessions. Is that right, Tim? Approximately. If people need more, they can have more. But that team deals frequently with issues of anxiety, depression, trauma, and substance use. And that team also works in conjunction with our other teams, and specifically with our opiate clinic. We have an intensive case management team, which consists of a nurse and outreach workers focused on adults with problematic substance use, and these are usually folks who are homeless or at risk of homelessness. The opiate replacement clinic is a service that's really growing in importance in our community. We have more than 100 patients coming to that clinic now, and it seems to be growing daily. We do that in partnership with our local GPs. And that provides methadone and Suboxone to, as I said, an increasing number of patients. Our community support team includes nurses and outreach workers and psychiatric supports, and that's for folks who have serious and persistent mental illness, such as schizophrenia and bipolar disorder. And they provide case management, advocacy, and various clinical interventions. One of our, I think, most effective and important programs is our vocational work program. And this is a program that people can come to who are struggling with mental illness and or addiction issues, but it really helps to provide them with a purpose in life, and also it helps them to gain skills that may make them employable in the future. And you may have seen some of our people doing landscaping and maintenance around the hospital and also in the community. And so this has been a really nice partnership with our community as well, because lots of businesses have been participating and offering internships and places for people to be employed within their businesses. So I think that's been just a really great partnership. We have an emergency psychiatric nurse program, and that's Shannon, as I mentioned. She works in a crisis role, and she works in the emergency department, often with Dr. Browley. You'll see the two of them down there, and they meet people daily in the emergency department. And I think really this program has been a real benefit in terms of people who are coming in and need assessment and just need to be able to find their way through the health system more efficiently than what we have been able to do in the past. And then we have supported housing. We've got one transition house called Orca House for people who have detoxed and they're waiting to go to support recovery. That was a gap in our system because it's a very vulnerable time for people. So we have that. That's located in Sechelt. And then we have a couple of homes, Chapman and Fairview, for people with complex mental illness. And finally, but certainly not least, we have one youth addictions counselor who works in the high schools. And so our services are primarily for adults, but we certainly see children and youth coming into the emergency department. And that's where our crisis services and our psychiatric and mental health emergency services nurse come into play. So I think it's really important to mention, and particularly around issues of anxiety, substance use, and depression, that we try to work with the local GPs. And our local GPs are often the first point of contact for people around these issues. And so we are doing more and more work in collaboration with the GPs and with the divisions of practice to come up with a system that's better integrated so that people can access services both from their GPs but also from Vancouver Coastal Health, and that we have a good way of working together and exchanging information to make sure that we have a continuum of services for people. So I also wanted to mention another form of service that we offer, and that's groups. And some of our group work is really applicable to issues of anxiety and substance use. And I'll just mention a few of them because I think that these have been a very effective way and a social way for people to come and address some of their issues. So one of them is called ACT for Anxiety and Depression, and that teaches mindfulness skills, cognitive behavioral therapy, and basically helps people to change their relationship to depression and anxiety. We also have meditation-based stress reduction, and I think there's a growing body of evidence that meditation and mindfulness are very effective, and someone was mentioning to me today that there's actually some evidence that these types of therapies can actually also create brain plasticity. And so, you know, beyond medicine, I think there are many powerful somatic ways that these types of issues can be dealt with. We have a group called Smart Recovery, and that's a weekly drop-in for addictive behavior. It helps people to find the motivation to abstain, helps around coping with urges, managing their thoughts and feelings, and their lifestyle balance. And so that's just a sample of some of the types of groups that we offer. And if you want to know more about those groups, we have some pamphlets out in the lobby, but you can also phone our services and find out what's on the roster. So that's mostly what I wanted to talk about. I did want to mention that I myself personally have had a very long history of thinking about the relationship between mood and cannabis because, well, my family were German farmers in the former Yugoslavia, and so they used to grow hemp, and they used it for spinning and cloth and, you know, creating ropes and that sort of thing. And so I also love to sing. And I grew up with parents who used to say to me in German, "Oh, sie singt wie ein Vogel in Hanf," which means she's singing like a bird in the hemp patch. And so I never really understood that until I became a teenager and may or may not have done my own experimentation around music and cannabis. I didn't inhale, of course. But I think it's also just an illustration that, that this is really an ancient plant. And it's something that we have a lot of historic and traditional knowledge of. And you know, we have members in the community who are continuing to do their own work, as we've seen this evening. But I think that, you know, again, I'll just emphasize that this is really, we're at the ground floor of a very exciting time. And I think, you know, the more of these kinds of dialogues we can have, the better an understanding we can develop about where we need to go, particularly in terms of health services and other social efforts to make sure that this becomes a process that's really helpful to all of us. So thank you.